All right. Is everybody ready? Is everybody ready? Are you sure you're ready? How do you show me you're ready? No, we can't get ready in our seats. We got to get ready in our feet, right? Do what you can. Do what you can. Get up on your toes. Hands in the air. Waving like you just don't care. Turn to your neighbor and say, woohoo! Woo! All right. Give yourself a round of applause. Well, we got the energy going, yeah?
I've got a question for you.
Question? Yes.
Is it your birthday next week?
The answer is yes.
Let's all sing you happy birthday.
Happy birthday to me. Happy birthday to me. Happy birthday, dear me.
How old are you going to be?
I'm going to be officially a senior saint. 55.
All right.
Yeah.
Did you get your AARP card yet?
Not yet. I'm working on it. I know if I have any questions about retirement, I can ask Bruce. He's always there for me. But thank you for the embarrassment. I appreciate that. I appreciate all the birthday wishes. Thank you. Thank you. No, I appreciate you guys. And, yep, Monday is our day, for my day. All right, so let's on with the show tonight. You guys are here for cancer prevention. Yes, yes. We have the right workshop. Yes. Next month, we have, just so you know, anti-aging. And you want to mark your calendars for that. It's going to be on the 14th. That's another gem. So I'll have you mark that. I'll have you make note of that. And raise your hand if you've been to 3 or more workshops already in our office. Good. Keep your hands up if you've been to 5 or more workshops. 10 or more? 20 or more? 30? 50? Keep your hands up if you've been to 100 or more. Keep your hands up. Oh, come on. Some of you guys have. Good, good, good. Yeah. So, I want you all to give yourself a round of applause for that. Yes. That is what we call the spirit of constant and never-ending improvement, right? Keep growing. Keep growing. When you stop learning, you stop growing, and when you stop growing, you start dying. Can you guys hear me all right with the mic? You hear a little mic or no? Not a lot of mic. Because we got to get this, yeah, for our Facebook friends. Okay, thank you. All right, so we want to start with asking ourselves a question. Why are we doing this? Like, why are you here now? I mean, what concerns you about cancer? Is it the fact that 1 out of every 2 people that we know gets cancer? Yeah, it's a concern. If you live long enough, chances are we'll be diagnosed with cancer. Most of the time it's benign, but every once in a while we get a scare, and it's just reality. So it's what you do now that determines the likelihood of that, the risk, whether it goes up or goes down. It's how you live your life now. So even though you may not have cancer, we thank God for that, but at the same time we can't take it for granted. You can't let your guard down. You literally have to live your life every day like you are fighting cancer, because what you're going to learn here is either you're letting it get a foothold and win the battle silently, or you're ahead of the battle and you're killing it. So the key is to kill it before it kills you. So what are your next 10 years going to look like? It's what you do now. It's how you think now and the decisions that you make right now. Right? Are you with me so far? Yes. Most cancers, thankfully, can be influenced to be muted and before they rear their ugly head. There are different types of cancers. You have hereditary cancer. These are the BRCA genes. Like, for example, remember Angelina Jolie? Remember she had a mastectomy. She had a double mastectomy because they detected these genes in her, and they said that she's definitely going to get cancer, and they scared her into doing that. Now, sometimes, there are these genes where there's a strong predominance, but what percent of the time is that? 5 to 10% of that. 5 to 10% of those genes, there's very little that you can do about those. But thankfully, that's the minority. That's not the majority. Familial cancers, you can influence by environmental factors to shut those genes off. Sporadic cancers, they call these, same thing. 70 to 80% of all the cancers that are diagnosed are what's called sporadic cancers. Thankfully, through a process called epigenetics, which is where we change our environment, limit the amount of alcohol, toxicity, tobacco, sugar, stress, obesity, nerve interference. These all have to do with your what? Your lifestyle. And if you pay attention to these and you make improvements in these areas, what are you doing? You're taking care of the 80 to 90% of the risk of most of the cancers. Are you with me so far? Okay. So these are the things that we need to pay attention to, because 90%, sometimes 95% of any genetic or predisposition of a risk to cancer, you have control of. You have control of with the decisions that you make and the way you live your life. And so when we look at this, we start looking at the way we live our lives. The environment that we subject our bodies to, the environment that we subject our cells to, because ultimately that's going to determine how the DNA expresses itself. If cancer runs in your family, then you have a risk of cancer. Yes? I know it's in my family. But am I concerned about that terribly? No, because I know that 95% of that risk can be reduced if I take the right actions on a day-to-day basis. So when we talk about environmental or lifestyle factors, first things first, we look at what type of lifestyle are we living that increases our risk of cancer. So obviously there are different medications, over-the-counter medications, prescription drugs, different testing that actually increases your risk of cancer. And so, do you have a pill-popping lifestyle? Do you live your life out of a medicine chest? Were you brought up that way? Raise your hand if you were brought up that way. I was. Yeah. My dad was a medic in the Army. If we had a problem, we had a pill to solve that. But they've changed. My parents have learned. And, when you look at all the advertising on TV, you take antacids, then enough time goes by and you see the report come out that it causes cancer. Antibiotics, we know, have an strong association with increased risk of cancer, because what do antibiotics do to your immune system? Make it stronger or weaker? Weaker. It may kill the bacteria, what they give it to you for, but it's going to leave you with an increased risk of more infections because it weakens your immune system. And long-term, repeated use of that increases your risk of cancer. How about cholesterol drugs? Does that increase your risk of cancer? Yeah, 83 to 143% increase. These are from medical journals. But people don't ask these questions. They just think that if everybody else is doing it, then it must be safe, it must be okay. This is part of the recipe that turns the cancer-promoting genes on in our DNA. That's what flips the switch and moves us closer to that cancer diagnosis. Are you with me so far? Say yes? Yes. Okay. So women taking an aspirin a day for 5 years or more increase their risk of breast cancer by 80%. So you guys, you get the point. What about mammography? Does mammography cause cancer? Well, if there's overdiagnosis, if there's over-testing and it leads to more treatments, yes, it possibly can. But mammography in and of itself, doesn't that consist of exposure to radiation? Yeah. Like literally hundreds of times more radiation than when you stand in front of the machine here that we take it 1/100th of a second. When you get a mammography, huge amounts of radiation, which absolutely increases your risk of cancer, especially if you're doing it every year. And then what happens? You have false positives, you have biopsies, which actually causes the cancer cells to rupture and increases the likelihood of metastasis and spreads, which happened to my mother. Chemotherapy, radiation. So you're subjected to these things when there are false positives that come from these mammograms. And the British Medical Journal published a study years ago, the largest mammography study that was ever done, history of recent civilization, finds what? No benefit. They found no benefit in the death rate from people, women who were getting mammographies and those who did not. Did you know that? Okay, so there are risks with this. So what do we see in October? We see the pink ribbon. Yeah, and a lot of these, are fundraisers that come from the heart. That we have good intentions. We want to help people. We want to get behind humanitarian efforts, and I get it, and I do too. And there are other charities that I support, but not this, because who's behind this? The manufacturers of the cancer treatment drugs. That's where it all started. But here's what they're finding now.
There has long been a debate in this country about the costs and benefits of cancer screenings. And now a new report is throwing another wrench in that debate, this time on the side of those who argue it can be very wasteful. The study, which was published in the Journal of Health Affairs, estimates that the U.S. spends $4 billion a year on unnecessary medical costs. Now, to be clear, this specifically relates to breast cancer screening and treatment. Let's take a look at how all of that breaks down. Now, about $2.8 billion was spent on false positive mammograms. That includes people who were told some kind of lump was found that happened to actually be no lump at all. Another $1.2 billion of that waste is attributed to breast cancer overdiagnosis. So that refers to the treatment of tumors that grow slowly or don't grow at all and are really unlikely to actually develop into a life-threatening disease.
So what was the majority of the money spent on? False positives. False positives. That's where the majority, those billions, the $4 billion. Did you get that? Yeah, so this is a real thing, guys. So that's why you have to think about what are you going to expose yourself to and what are the potential outcomes. And then you make your decisions. Not very much different for PSA screenings. What does PSA mean? If you have elevated PSA, does that mean you have a prostate problem? That's prostatic specific antigen, which is not specific for prostate cancer. If you have an infection in your prostate, if you have a normal, healthy, benign enlargement of your prostate, if you have an irritation or inflammation in your prostate, you will have elevated PSA levels. And it's going to be scary when you go to the doctor and they tell you that you could have prostate cancer. And then they suggest you to more tests. And then they do more screenings, and ultimately you may wind up with a false positive and what? Unnecessary treatment. You need to be very, very, very careful with this. The man who invented this test said it was the worst thing that he ever did. So now, from the Annals of Internal Medicine, recent studies have shown, and most medical doctors should know this, that the prostate exams are not appropriate for non-symptomatic men without symptoms, and in many cases it's worse than doing nothing at all. So everyone has cancer. Who has cancer? Everyone. So if you live long enough, you're going to deal with it. Autopsies find that prostate cancer is in 30% of men over the age of 50, 50% by the age of 70, and 80% by the age of 90. If a man lives long enough, he can expect to develop prostate cancer and expect to die with it and not from it. How many people go to their grave carrying these cancers and their body's dealing with it, and then they don't find it until the autopsies? But if they would have messed with it before when they were alive, it might have made more problems than if they did nothing at all. Colonoscopy screening studied that precancerous lesions in almost half the general population by the age of 80. So it's very, very common. So when we hear this C word, the cancer word, we shudder, we go, we have an anxiety attack, but the reality is it's normal. You just have to understand what's happening, and then we can make decisions moving forward. So when my mom was diagnosed with cancer in 2017, the first question that we asked was, okay, we don't care why you have it, we care that you do have it, and now we care about what the decision's going to be. How do you deal with it? How do you correct the cause? She said, well, we need to get a biopsy, and then they'll do some surgery, and then after that they're going to do radiation and possibly chemo. She's like, but I don't want any of that. In the end, what did she do? All of it. All of it. Why? Because despite my knowledge, and my brother, and I'm in her right ear, my brother's in her left ear, she had decades of medical brainwashing, along with all of her family members who are medical doctors telling her to do exactly what caused her to make the decision she did. And of course, I loved her through every minute of that, and I did the best that we could. And ultimately, the discussion was, you can burn it out, you can cut it out, you can radiate it out, you can give chemotherapy, but in the end, if you don't correct the cause, what happens? 100% of the time. 100% of the time, always. So, I was just having this conversation with somebody yesterday with fibroid tumors. I said it's the same thing. Fibroid tumors it's cancer. Your body makes cancer. It's a disease of metabolism. She's like, well, what do you think about this new treatment they do where they go in with, it's a special treatment to take the tumor out. It's a surgery, but it's like a laser specially advanced and this and that. I'm like, okay, if you decide to do that, that's fine. That's out. But if you still have the conditions that fed the cancer to grow to the size that it was at, if you still have those conditions, what's going to happen? It's going to come back. So you haven't solved the problem, the cause of the cancer to begin with. That's what scares me the most. If somebody decides, whether it's my mother or you or anybody else, somebody decides to have chemotherapy or radiation, listen, that's what God gave you a brain for. You make the decision. You pray on it, you get the information. It's your life. It's, everybody has to decide for themselves. But let's not fool ourselves. We're not correcting the cause, the source, and the root unless we get down to why we get sick in the first place. When you look at this, what do you see? A dirty fish bowl. You see black fish. They're diseased. They're sick. Why are they sick? What's the cause of the fish getting sick? Their environment. Very good. Okay. So let's give the fish some fish food with nutrients and supplements and vitamins, and let's try to treat the fish and leave them in the sick, disgusting, dirty water. Who's up for that? That sounds like a good plan, right? No. What's the solution? Change the environment. You don't have to do anything to the fish. Just correct the cause of why they got sick in the first place. And how we approach a cancer diagnosis and the treatment of cancer, really more often than not, should be the same thing. Should be the same way. What's the environment that these cells are being bathed in? What's the environment that your body is exposed to? Because your body can only do the best with what it's got. If you give it what it needs, then you will remove those limitations, because the power that made your body has no limitation to heal your body. Think about it. When you cut your skin or you break a bone, does it heal? Sometimes, a little bit, maybe, I hope, I wish. No, it heals what? 100% of the time. If I open up my hand, will this remote go up? Sometimes, maybe. Or will it go down? So you have to understand that your body is smart. It wants to get well. It doesn't like being sick. And surely we can't poison our way back to health. And so we all agree it makes sense. But when push comes to shove, when the poop hits the fan, all that logical thinking, whee, goes right out the window. Okay, that's why we have prayer. Because we don't make decisions when we are in fear and we have anxiety. You pray. You have to get past that point. And then you apply the knowledge. And then you can make intelligent decisions. No disease, including cancer, can exist in a what? An alkaline environment. Who said that? Dr. Otto Warburg won a Nobel Prize in 1931 for his research on cancer. And what he discovered that the metabolism of the tumors and cancers did not do well in oxygenated environments. Cancer does not utilize oxygen as part of the metabolism. What it utilizes is sugar. That's what he discovered there. So now when you have a PET scan, when you see a PET scan these days, they actually call it the Warburg effect, where they see all the sugar being consumed. Did you know that? So this is where it all started. Now, all his information just kind of got flushed down the toilet. We don't hear about it. Nobody talks about it. But it's really at the core of cleaning up your internal environment. What did he say? No disease can exist inside of what environment? Alkaline. So it just so happens that he knew, which is still true today, ever since the day you were born, your body's supposed to be slightly alkaline on the inside. And when the pH is proper, you have a healthy environment for the cells to utilize oxygen, create energy, and allow the DNA to express itself normally instead of expressing disease. Are you with me so far? All right. But when you mess up that environment with what? If you look at everything on the left here, the hot dogs, the processed meats, alcohol, sugar, caffeine, artificial sweeteners, high fructose corn syrup, right? What are we doing? We're acidifying our internal pH. And what does that do? Feeds the cancer. It creates a hospitable environment because cancer will feed on that sugar. And as a result of the metabolism of that sugar, it leaves in its wake this pool of lactic acid. And guess what? That kills all the other good cells around it. And it makes a perfect breeding ground for cancer to survive and thrive and multiply in. And what are we doing? We're feeding the cancer. Now, on the other hand, it just so happens that the foods by God, the natural foods, the good foods, low sugar, fruits, vegetables, Water, most waters are highly alkaline. Lemons, limes, tomatoes, avocados. You know, when you start looking at the good foods, the healthy foods, it just so happens it supports a healthy pH. And when the cells are bathed in a healthy pH, they actually repel each other. They're full of oxygen, and their metabolism is normal, and cancer doesn't like those cells. There's nothing to feed the cancer when you have that type of environment. Does that make sense? Okay. So that's important because this is one of the strategies when initially my dad took my mom, we sent them to Spain, and they have these alternative treatment centers where they don't use conventional treatment like chemotherapy and radiation. They do other types of modalities. And so in Spain, Dr. Helu, who is a world-renowned oncologist who doesn't use that, he uses natural methods. My parents spent 3 weeks there while she went through this. And this was one of the tenets that they used to alkalize her bloodstream. She had therapies that would cause and create an alkalining effect on her blood, and that was one of the strategies that they used. So, also, in addition to this, in terms of your internal environment, your blood sugar is probably even more important in terms of whether you're going to feed cancer or start it. So this is what's called a PET scan. On the left, you can see that. And those little lights there is what? That's where the cancer is gobbling up the sugar. Why? Because breast, prostate, and colon cancer cells have what? Insulin receptors. And what they do is they hijack the sugar, and that's where you're seeing it. The metabolism of the sugar by the cancer is what you're witnessing on a PET scan. PET scans measure how much what? Glucose is being consumed by active cancer cells. So insulin is actually a nutrient sensor, and what it does is it opens up the growth factors inside the cells, and it starts feeding them, and then what happens is bad things happen from there. So we have to read the ingredients. We have to stop feeding the cancer. It's one thing if you've been diagnosed. It's one thing if you're fighting it, but it's another thing if you're preventing it. So when you look at that there, you have to ask yourself, really how much sugar is in your diet on a day-to-day basis? Because even if you have not had an active cancer diagnosis yet, if you have a diet high in sugar, if you're pre-diabetic, if you are diabetic, what is your risk of cancer relative to somebody who's not? If your insulin levels are high, if your A1C is higher, you have a higher risk of developing and being diagnosed with cancer, right? So that's what we have to look at. That's why this is so important. When you go home, how do you make application with this? Open up your pantry. Start reading the labels on all of the foods that you buy at the grocery store. And you will be shocked at how much sugar is in there. So these are some of the things. I won't go into it piece by piece, food by food. We don't have time for that. But you guys get the message, right? You understand the point that I'm talking about. So we should be looking to make a transition from wherever you're at to what you can do better. And when you look at the food pyramid on the left, that's what has been recommended to us ever since we were in elementary school, where the base of the pyramid is the majority of our diet, which is what? Carbs. Which does what? Raises insulin. Which does what to your risk of cancer? It increases it. So, how do we transition into something more healthy? Well, you look at something like either the paleo diet. If somebody's an active cancer patient, a better recommendation would be the keto diet. But paleo diet is something that anybody can really embrace. And if you look at that on the right side, you see, what does the base really consist mostly of? What? Greens, vegetables, right? And then right above that, you have your meats, right? You got your eggs, you got your chicken, you got your red meat. Even if it's grass-fed, that's fine, right? And then above that, you have your good fats. You got your butter, avocado, coconut oil. Then you have your low-sugar fruits, your berries. Not endorsing the wine. It was just part of the picture. But you guys get the point. And if you do that, what are you doing to your glucose? You're keeping it what? What are you doing to your insulin? Keeping it what? What are you doing to your risk of cancer? Keeping it down. That's why this is healthy. And you know what? Along those lines, you won't have any trouble managing your weight. Your weight stays nice and steady. Your belt stays steady. Your waist stays tight. Because your body uses those good healthy fats to burn fat also. So there's no feeding the cancer with that type of food choice. So this is a ketogenic diet. If there is a cancer diagnosis, if somebody's actively battling cancer, all the sugar out of the diet. There's no berries there. There's no fruit there, right? You don't even see vegetables there, do you? I mean, technically, you could say the avocado is the fruit, but you got the point. You got just good healthy fats and meats, protein. And so there's nothing there for cancer to feed on. What happens is your body starts changing over from using sugar to ketones, which is a different source of energy, and fat. And cancer can't do that. Cancer cannot utilize fat. It cannot utilize ketones. And so that's, the whole premise behind starving the disease out of the body. Makes sense, doesn't it? Makes sense? Okay. So another way to stop cancer from feeding on your cells, on your body, is fasting. Now, we're all familiar with this. It's been in different religions for eons, as long as we can remember learning about this. But when they started doing studies on this back at the beginning in the 1900s, they were able to demonstrate the inhibition of the growth of tumors. This was back in 1909. 1914, they did a food restriction study. It showed a 50% reduction in cancer risk. Now, you don't have to even fast like a whole day or a week. You could do time-restricted fasting. But at the same time, it reduces most of the cancer growth pathways. It shuts those tumor sensors, those growth sensors down. It shuts them down on the cells, so they cannot hijack the sugar. And at the same time, it also increases something autophagy. Everybody say autophagy. Autophagy. What is that? That's like that's your body cleaning out the dead, old, bad cells and making room for the new. And that's also a healthy process that you go through when you fast as well. Intermittent fasting protects against many of the cancer risk factors, also diabetes and obesity and inflammation. So what's time-restricted eating? Well, basically, you look at all the hands on the numbers on the clock, and you say, well, I'm only going to eat between these hours. And so a couple of you in here, you did the time-restricted eating when we had you on the metabolic correction program, right? Sybil, you did that. Right, Vivette, you did it also? Right?
I did.
You did, yeah. Yes, you did. Yeah, it was a long time ago. It's just a couple of weeks ago, wasn't it? They said lost 15 pounds. Sybil, you passed 30 pounds, right? Okay, so what did they do? Part of what they did was eating within an 8-hour window. So in other words, you start eating you don't eat until noon, and then your last meal would be as late as 8 o'clock. But that's it. There's an 8-hour window during the day that you eat, the rest of the time that you don't. Now you can do versions of this too. You don't have to do that. So usually when I get home, I'll get home around 6 o'clock, 6:15. I'm having dinner, and then I won't eat breakfast until 7:15 the next day. So that's 13 hours. And so these are effective strategies, and they're very, very healthy for your metabolism. And it helps you sleep better. It helps you keep your weight down. It helps your metabolism work properly. It helps your body heal. And it all stems from all of this research that's been around for a really long time. That's amazing, isn't it? Say yes?
Yes.
Okay. Nobody's sleeping. That's good. All right. Obesity significantly raises your risk of cancer. Why? In 2016, a review of 1,000 studies, it showed that breast and colorectal cancer, which is the majority of the cancers that are diagnosed these days, 40% of them, they're related to what? Obesity and excess body fatness. And how do you know if you're obese? How do you know if your body's over fat? There's a way to tell, other than what you think or what the scale tells you. In 2003, there was a million participant study. They showed that those whose BMI greater than 30 suffered 52 to 62% more overall cancer death. So that's a pretty important number that we should be paying attention to, don't you think? Do you know where your BMI is? Like, you may know what your weight is, but what's more important than your weight
is the BMI, which is the height-weight ratio that the World Health Organization instituted worldwide, because they know that once you go over 30, you have the highest risk for cancer, heart disease, and diabetes. They found that the risk of liver cancer increased by 452%, pancreatic cancer increased risk by 261% if your BMI was over 30. So that's why I ask you, do you know where your BMI is? Maybe it's over 30, maybe it's not. But I'm sure we would all agree we can do better than just guessing. So a body composition analysis will tell you exactly where it's at. Many of you have done this. When you stand on it barefoot, and it puts a low-level electrical impulse through your body, and it breaks all these factors down inside of your body. It tells you what your BMI is, your body mass index. It tells you what your body fat percentage is. And it'll tell you if you're obese, if you're over fat, if you're overweight, and where you are in that as far as what your risk factor is. If you're here for a cancer prevention workshop, what's the most important thing that you're learning right now? What's your risk factor based on your weight? If you know you're overweight and you want to do something about it, it's a good time. It's a good thing to know where your starting point is, or how urgent it is or not that you start doing something, when you should do it. And your visceral fat, that's also important. Why? What is the visceral fat? That's the fat around your what? Around your organs. Your fatty liver disease. That's really what it points to. So the liver, the gallbladder, the heart. And then also it tells you your metabolic age. So, if you're 60 years old and your metabolic age is 90, that means your metabolism is shot. It's working really slow. And unless you get that fix your whole metabolism, you're always going to have trouble with your weight, which is the least of your concerns if your risk of cancer is off the charts because of this. I'm trying to put this in perspective for you. So if it's making sense, what tonight is about is checking the box. Okay, as I'm going through this stuff, you may be saying, yeah, I'm good with that. Yeah, I'm good with that. And so, some of us may be fooling ourselves, and some of us may be accurate with that. But for some of you, you're thinking, and I need to get going with this. I'm almost there. I need to get going with this. I need to do this. And if you do, and that's what you're thinking, then don't not act on it. What are you waiting for? So if you want to get one of these done, ask them up front. It's very simple to do. If you're an active patient, if you're under my care now, and you haven't had it done, we'll do it no charge. If you're a guest here and you want to have it done, we do it for $37. But I'll sit down with you and I'll explain it to you. I'll tell you where you're at, if there's a risk factor there, and what you can do. But you can ask them up front at the end of tonight, and we can help you with that. So let's talk about toxicity. Do toxins cause cancer? Yes or yes? Yeah. So we have to take inventory. How many prescription medications are you on right now? I don't tell you to stop taking your prescription drugs, right? I don't tell you to do that. However, you hopefully are thinking about doing things that would enable you to be less dependent on them as time goes on. Is that fair enough to say, right? And many of you have. Many of you were on 7, 8, 9. Bruce, you were on 7 different medications when you first started. You're down quite a bit. Down to 1 now. So that's awesome. So we're not looking for perfection. Nobody's perfect. I'm not perfect. You're not. There's not one person. But there's room for improvement. Raise your hand if you believe there's room for improvement. Say aye. Aye. Okay. So that's what we're talking about. And if you have lots of these and you're not making progress and you want to, let me know. And I want to know what I can do to help. Because this is toxic. Didn't grow. The pills that you pop, they didn't grow on a tree or out of the ground, right? Right. So they're pharmaceuticals. They're chemicals, and it's cumulative. It builds up in your body in the cells, and it expresses the way the DNA changes the way the DNA expresses itself, possibly increasing your risk of cancer. And then you have soap and toothpaste, and you got all these things with sodium lauryl sulfate, cancer-causing ingredients in them, and aluminum in your deodorant. There's all kinds of crazy cocktail of poisons in these things, and if we're not deliberately going to the store and buying the natural stuff that doesn't, you're allowing these toxins to infiltrate your cells and pull the strings on that DNA, and it's not good. you know, most of us, if not all of us, were vaccinated as children, and there are heavy metals in those. Don't let anybody tell you different. I had lots of them when I was a kid, and it's just how it is. You know, you got the mercury in that. You have the fillings, the amalgam fillings. Many of us still have those, which is a no-no. It's not good. It goes to your brain. You have lead in our water sources. And it doesn't matter how good the city water supply is or how good they say it is, there are still traces of it, and it's worse in some place than others. And you just don't know. And it's cumulative. Lead in cosmetics, lead in paint, in the houses, and that stuff gets stored in our bones. And then as we get older and we go through hormonal changes, what happens? The lead is released into our body and our brain. So then you have glyphosate. And what is glyphosate? The active ingredient in Roundup, which they use mostly on which two crops? Corn, very good, and soy. Yeah. And what do they use corn and soy in? Which types of foods and drinks? Everything. Yeah. So this is the world we live in. It's highly toxic, and it's just like we're the fish in the fishbowl. Right? We're the fish in the dirty fishbowl. So you have to keep going through these things and make sure that you improve on them, because ultimately what happens is it causes inflammation at the cellular level. It causes what? Inflammation at the cellular level. And what that does is it doesn't let the nutrients in that need to get in the cells and nourish the cells and nourish the DNA and allow the function of the mitochondria, which creates energy, and allow normal cellular replication. And it doesn't let the toxic byproducts out, the waste, the metabolites from the energy that's created inside the cell. It doesn't let it out. It's like having a fire in your house and the smoke doesn't come out. The fire doesn't kill you. What does? The smoke. And this is what your DNA is bathed in, which what? Turns on the bad genes, increasing your risk of cancer. You see where I'm going with this, guys? So we have to attack these things one at a time. In toxicity, if you have not gone and peeled back these layers, this is really important, because this is the difference. This is where you start significantly reducing your risk of cancer by addressing these toxins. Not just at a body level, but at a brain level. Now, if you're not sure how toxic you are, everybody in this room has some level of toxicity. You can be tested. The meta-oxy, which is the urine test, we have a little reagent we mix in there, and we do it right here in the office. When you come out, we see the color on that, and it can show us how much cellular inflammation that you actually have, and what and where it may be due to in terms of toxicity, by way of also using a questionnaire and a visual contrast sensitivity test. So there are lines that we put out inside of you that you look with your eyes. Toxins affect the optic nerve. And at a certain point, if you are toxic, you will not be able to read the lines on the chart. And so we can come up with a grading system and show you how toxic you may or may not be. And if you're really, really toxic, then it's obviously a good idea, if you want to be proactive, to reduce your risk of cancer and reduce all the inflammation throughout your body. I just got done with mine. It's a 90-day cycle. And I'll tell you, man, it's life-changing. It's absolutely life-changing. It's so life-changing for me, I do it at least once a year or 18 months. Because my genes, my body particularly, needs a lot of help with detoxing. Now, there's lots of other things that I can share with you, but I want to give your mind a rest for just a second. So, because the mind can only absorb what the seat can endure. Right, Dudley? Right? All right. So I want to make mention of some our favorite patients who have put their best foot forward and have done so amazingly well with their adjusting schedule. Never, ever, ever miss a visit. You know what we love about that? Not only that it makes their job easier, they don't have to sit and call everybody at the end of the night, but it also is great because the people who keep their appointments, who are consistent with their adjustments, get the best results. And I love seeing that. And I know you guys do too. So I want to recognize two special people tonight for perfect adjustment attendance. And I'm going to have you stand up when I call your name.
Lisa Mann and Veronica Johnson. Everybody give them a big round of applause. Got a special Medal of Honor for you. Special Medal of Honor. Yes. All right. Well, now I'm going to have everybody stand up and turn to your neighbor to the right and put your hands on their shoulders. And what I want you to do is squeeze. Get all that stress out. Get all that stress out. Wake them up. I saw a couple of eyes starting to close. I could call them out by name, but I won't embarrass you. Now there's no excuse. Okay, karate chop. Good, good. All right, that's good. Okay, turn around and love your other neighbor. Squeeze, get that stress out. Not too hard.
Oh, go for it.
Just wake them up. Just enough to wake them up. All right, karate chop. Wake up. Wake up. Wake up. Okay. Good job. Everybody give yourself a round of applause. Yay. Okay. So, this is worth mentioning. How many of you guys have ever tried the Complete Clean, the shake? Yeah, I do that every morning. It's got a complete multivitamin spectrum on it. It's got every multivitamin or every vitamin, antioxidants in it, minerals, and it's very high in protein. So I'll have this after I exercise in the morning. 26 grams of protein, very low in sugar, and to address the toxicity that we just talked about, it has a very gentle daily detox support system in it for phase 2 liver detox. It uses something called N-acetylcysteine, which is the precursor for boosting the detox that you need inside your liver and your kidneys and the detox pathways. So this is a real easy thing. It's a very gentle support system as far as detox goes. But most importantly, it just kills a lot of birds with one stone. It's very tasty. Green tea also in there we know that it's cancer preventative. And then turmeric extract is one of those supplements that actually kills cancer stem cells. So that's why I circled all those for what we're talking about tonight. Again, it's one stone that kills a lot of birds. So in your handout, I also put a supplement suite. People are always asking, what supplements are good for this, what supplements are good for that. The ones that I picked out are the ones specifically that are the most effectively and widely used for cancer preventative strategies. It's not a cure for cancer, but very effective at mitigating certain things that cancer is connected with. One of them is ultraplex curcumin. We know through research it's got the most evidence-backed literature as a cancer support supplement. It destroys cancer stem cells, and it's also an anti-inflammatory. So even aside of this, aches, pains in your back, all throughout your body, knees, things like that, these are therapeutic dosages in these capsules, so it's highly potent. Vitamin D, why is vitamin D important? Not just for strong, healthy bones and teeth, but you need to know, you probably do know at this time, low vitamin D is one of the leading causes of heart disease and cancer. So we know that. And then other studies show that if your vitamin D level is at or around 70, you could prevent nearly 50% of all the cancers. Breast cancer, prostate cancer, colon cancer, lung cancer, pancreatic and ovarian cancers. Can reduce your risk by about 50%. So when you look at your vitamin D level, when you come from your medical doctor and your blood test shows that it's in that normal range, where is that usually? 30, yeah. So that's less than average, not ideal. Ideal needs to be at 70. That's why I started doing these vitamin D tests, the finger prick tests in my office, because vitamin D is one of those little things that makes a huge difference in terms of your immune system being at full strength and preventing cancer. And it's such a little thing, but you just don't know where you're at. Raise your hand if you take a vitamin D supplement. Good. Most of my patients do. But what I found when I started doing this test, even that 5,000 international units,
Most people were not anywhere near 70. So some of you guys need 10,000 international units. You just don't know where you're at unless you get tested. Now, it is possible also to take too much. And that's, again, why we test every year. Because we keep eyes on that. And then sometimes you have to back off. So it's something that you need to have checked regularly. And it has 100% to do with your immune system and your risk of cancer. Right? All right.
Right.
Okay, good. And so here's another supplement, Ultraplex Onco. What does Onco mean? Onco is cancer, referring to the treatment of. Sulforaphane is a highly potent antioxidant, which has long been known to have benefits with cancer patients. It's an anti-inflammatory. It helps support detox. It's neuroprotective for Parkinson's, Alzheimer's disease. It helps support good, healthy gut. What's in your gut that's so important with your immune system? Yeah, literally. 70% of your immune system is in your gut, or more. Ultraplex CoQ10. What is CoQ10? What's so important about that? The heart cells, because statins strip the CoQ10 out of your heart cells, the heart muscle cells. So not only is it good for your heart cells, but it's good for every cell. It's good for cellular regeneration. So for tonight, for being at the workshop, only time we ever give discounts for the supplements is at the workshops. So I would encourage you to take advantage of it if you want to take advantage of the savings. Ask them up front before you leave, and they'll help you with whatever you need. All right. So, and then tell me about stress. Tell me about stress.
Kill.
Does stress kill?
Yep.
Does stress cause cancer? Yes.
Any disease.
What's that?
Cause any disease.
Stress can cause any disease. Let's talk about why. There's a neurological connection to this, and I want to explain it to you, and I want you to understand what's happening here and how this works. Let's start with your gut. 70% of your immune cells are where? In your gut. Yeah. So your autonomic nervous system plays a big part in how your gut is able to communicate with your brain and the rest of your body. Not just with the immune cells, but also with serotonin, your feelings of well-being, happiness, all the neurotransmitters, all of your body chemistry, right, has to have a good gut-brain connection. We have something called the autonomic nervous system. Say autonomic. Autonomic. What does autonomic mean? It means automatic. Yeah. So you have two parts to this autonomic nervous system. Who has two parts to their autonomic nervous system? Everybody raise your hand. Okay. What are the two parts? You have the parasympathetic, which is the rest, digest, and repair. And you have the sympathetic, which is the fight or flight. When you have lots and lots of stress, and you're always in survival mode, which part of your nervous system becomes dominant? The fight or flight. Yeah, that's the adrenaline response. That's when, somebody's chasing you or you're chasing somebody, and it's a life or death situation. What happens? Your eyes dilate, your heart accelerates, your lungs open up, right? It decreases your digestive function. It decreases the function of your intestines. And what happens with that? Well, you have overstimulated adrenal glands, and you have something called cortisol, which goes up. Everybody say cortisol. Cortisol. When cortisol goes up, when you're under lots of stress, it takes insulin with it. So what happens to your belly? It gets nice and big. You start packing on the fat. But what it does is it spreads inflammation all throughout your body. When you're under stress, your body aches. You're in pain. Your joints ache. Your whole body is inflamed. And what does that do for cancer? Spreads it like wildfire. Yeah. So what is the main connection? What is the main conductor of this autonomic nervous system that harmonizes and coordinates all of these functions? It's something called the what? The vagus nerve. In Latin, vagus means wanderer. It starts right up here in front of the atlas, and it goes all the way down, and it innervates and touches and controls some of the organs or all of them. All of the organs are controlled by this vagus nerve, making it faster or slower, one way or the other. And isn't it interesting that that vagus nerve comes right off in front of which bone? The, sing it, Judith. Does anybody know that song that Judith knows? Does anybody else know that song? She's the only one that knows it, but I love it. At last, at last. So it's the atlas bone. So there's all kinds of research coming out on this. I put a few slides in here from our gut-brain connection workshop. I don't know if you guys had a chance to see it, but all kinds of emerging research from every medical field in every country coming out on this vagus nerve. And they're doing really crazy things, medical doctors, with this to control it. They actually put vagal nerve stimulators in people, surgically implant them to control it. This one from the Journal of Physiology says that the vagus nerve seems to be a good therapeutic target in inflammatory conditions of the digestive tract. Example, irritable bowel disease, but also other inflammatory conditions such as rheumatoid arthritis and others. So they're looking at this and they're seeing the effect of the vagus nerve, and they're modulating it with vagal nerve stimulators to get the desired anti-inflammatory healing effect. Wow, that's pretty cool. Imagine if we could do that without surgically implanting it. Imagine if we could alter vagal tone without surgery. But wait a second, can we? Is that a trick question? No, it's not. How do we do it? How, Judith? Using the what? The atlas. Atlas, yes. 7 ways to improve your vagal tone. Gargling, singing, humming, chanting, massage, laughter. What are these all doing? Relaxing the tone of your vagus nerve. You know, like on a guitar, when you keep twisting the knob and it makes, you're tuning the strings, you're creating tension and it changes the tone, the tension on that. If you have tension in your nervous system, you're changing the tone of the vagal nerve. If you want to relax the tone of that vagal nerve, you bring balance to that autonomic nervous system. Are you with me so far?
Yeah.
Yoga, Tai Chi, deep breathing, exercise, and what else? Chiropractic. Yes, that's right. Studies have been done and shown conclusively that cervical adjustments, where? In the neck, at particularly the level of the atlas, may result in parasympathetic responses. Now, if we said sympathetic was fight or flight, then what would parasympathetic be? Rest, relax, digest, recover, right? So what usually happens after a good atlas adjustment? Well, especially for people who just start care, first thing I hear, you go home and what? Sleep. You know, one girl just texted me back, she says, it's like best night's sleep I've had as long as I can remember. Just feel well rested. You wake up the next day, you just feel well. Just because your whole nervous system is getting readjusted. It's like adjusting the radio dial and taking it from static to clarity. That's what your brain hears and your cells hear from your brain. And that's how we should be living our lives, right?
Yes.
And that's what true health and healing and homeostasis is. It's a balance of these things. And how does it happen? Through one adjustment at one area, without drugs and without surgery, at the atlas. Yeah. Here's another study. Showed the reduction of pro-inflammatory cytokine secretion was observed in cultures from SMT, receiving shuttle, which is spinal manipulative therapy that they called it in this study, which is an adjustment right at the atlas. That's what it is. And what did it do? It reduced the inflammatory response. So again, from a pain standpoint, this is part of how that process works. Are you guys getting this?
Yeah.
All right, good. So then what is a vertebral subluxation? It's a misalignment of the spinal column which negatively affects neurophysiological function. So when you have an atlas subluxation, that's what happens. The bone shifts out of alignment, puts pressure on the brainstem. And remember, the vagus nerve comes right off of that, so it interferes and changes the tone of the vagus nerve because of the tension that it puts on it, right?
Right.
It can cause a lot of other issues, but talking about what we're discussing tonight, that's what happens. How does that affect your risk of cancer? Increases inflammation. What else? Alter vagal tone, anxiety, fight or flight. And so a number of different ways it throws your autonomic nervous system way out of balance. And it weakens your immune system. You start getting colds, flus, right? Increases your risk of cancer. So this was a study on AIDS patients that got chiropractic adjustments versus the people in the same study who did not get chiropractic adjustments. The ones that got the chiropractic adjustments here at that atlas level only, they didn't adjust any other part of the spine, saw a 48% increase in their white blood cell count. So just from that adjustment right at that level, what did it do to the immune system? It what? It strengthened it. It raised it. And that study was in 1990 when I just started chiropractic school. Blew me away. And I graduated in late 1993, 94, and I took a copy of that study and I went to a local AIDS shelter. And you know what I did? I replicated it. Saw the same thing. All my patients that I was taking care of, all their numbers, just their viral loads just went down to nothing. Many of them were able to get off their medications. And that's what the adjustment does. That's what it does. Is the longer you're doing it, the better it is. Chiropractic and vagal tone. Here's a study that shows skin temperature differentials associated with subluxation. Autonomic dystonia. If you want to find out if your autonomic nervous system is out of balance, what's a good way to tell? By getting a what? A scan. That's why if you're under my care, we do this at the progress evaluations so that we can see how well balanced your nervous system is or not and see what we can do better. Now, if you're not under my care, if you're a guest here, this is one of the important things that we establish when we do a new patient exam. What causes vertebral subluxation? What can cause the vertebrae to shift out of alignment? Stress. What kind of stress? Mental stress, financial stress, chemical stress, toxicity we talked about, right? Trauma. You know that picture that I just showed you with the atlas like this? That was my dad after he dove into a lake, and at the bottom of the lake there was a cast iron tub. And he didn't know it was there. And he woke up in an infirmary 2 weeks later with his head feeling like it was going to explode. And he spent the next 40 years suffering from migraine headaches every single day. Destroyed his life. And then I came home from chiropractic school, and I was practicing on him. I adjusted him. And that was the last time he ever had a headache. So this is a real thing. You know, we have physical stresses. We have fender benders, slips, falls, car accidents. We sleep on our stomach. We sleep the wrong way. We get out of bed the wrong way. We have this. We have that. It's just the world that we live in. It's rare to see a spine that's perfect. I can't remember the last time. It's like being a dentist and having people who don't brush their teeth come in and not have cavities. Hello? You know, it's called spinal hygiene. You're supposed to be having your spine checked every once in a blue moon. It does make sense, doesn't it? After all, it's your nervous system that's controlling everything.
Mr. Lawson, it's so great to have you here in the office. And I remember reading your testimonial on the radio a couple days ago. I told you it's just an amazing testimony. Just wanted you to tell the viewers exactly of your experience. I mean, you are a cancer survivor, multiple myeloma to be exact. And you came here because you didn't want the chemotherapy, which they told you was preventative. You've already had surgery. And you have shared some remarkable results after being under care now for about 8 weeks or so. And what have you noticed in terms of the blood tests or the medical testing that has done before care and now after?
Okay, one of the main elements of the blood test is something that the doctors call IgG. I don't remember what it means, but when I came here, it was like about 4,000 and something, 4,000 plus. At that stage, I was scheduled to start chemo for the third time in about 2 weeks. But after about 2 weeks of chiropractic care, and I went and did my blood work, that 4,000 was reduced to 3,400. And I said, wow. So when the doctor called me, I said, Doc, I'm not ready yet. And so I continued the chiropractic care, and I've done another blood work since, and it dropped to 3,000. I'm doing another one in another 2 weeks, and how my body feels, I know it has gone down further. And so this has prevented me from not going back on the chemo. You know, and it's just so exciting for me.
That's great, because what you've learned is that God put an amazing healing power inside you. And power that made the body heals the body. We just got to find and remove the interference, and you're putting that application into play.
Exactly. I'm convinced that the process of subluxation had caused this sickness on me.
Yeah.
And so it's now being corrected.
That's right.
And I just have to give the body time and help it along
Exactly.
with nutrition and more natural foods and exercise to have it corrected. And I'm convinced by God's grace it will be reversed.
The best is yet to come. Thank you. God bless you, Brother Lawson.
Great.
Okay.
That was probably at least 10 years ago, or actually more than 10 years ago, and somebody came in who goes to church with him. I haven't seen him in a while, and he's still alive. He's still alive. He's a cancer survivor. He's a fighter. But you see how what did he say? He said that he understands that the process of subluxation is what caused the environment that created the conditions for the disease to develop. And so you can eat good and exercise till the cows come home. But if your nervous system is way out of whack and you don't address that, you miss the most important thing, right? Studies show that people under chiropractic care for 5 years or more have had their immune systems on average made 300% stronger. This was a cancer research study from the New York University Cancer Research Center. So this is a real thing. Most of you guys in here, you've been under care at least 5 years or more. Raise your hand if you've been under my care 5 years or more. Yes. Have you? And so, I don't know, this is kind of like a dumb question, right? Have you noticed yourself getting more sick or less sick, right? Like you hardly. So somebody who's in here, he's been under my care since 2008. He's a teacher. He's never taken a sick day since he's been getting adjusted since 2008. So for if you're a guest here, you're probably, what is this, a cult? Like these people are crazy. No, it's a real thing. It's not even a chiropractic thing. We're working with the nervous system, right? It's universally known in every health profession. If you read this, it comes from Gray's Anatomy. It says on top that the nervous system controls and coordinates all organs and structures of the human body. It's stated in Gray's Anatomy, 29th edition, page 4. Misalignments of spinal vertebrae and discs may cause irritation to the nervous system and affect the organs, structures, and functions, and may result in the conditions below. That's from a medical textbook. So when you see that up there, that top bone, that's the one where the vagus nerve comes off, and you see all the effects. Headaches, nervousness, trouble sleeping, head colds, high blood pressure, migraines, nervousness, forgetfulness, tiredness, dizziness, all symptoms of sympathetic dominance, autonomic imbalance. And that's the one area that needs to be addressed. And then sometimes, but less often, you can affect the immune system from the middle part of the back. But if you look at that nerve chart, it's like a circuit breaker. Any disease known to mankind can be traced back to that spine, 100% of the time. If there's a disease, if there's sickness or a symptom, we can trace it back 100% of the time. We'll find a problem there, 100%. So, again, I know it sounds like for some of you I'm preaching to the choir, but raise your hand if you learned something new tonight. Yeah. Did you learn something new tonight? Oh, yes. Okay, good. Okay. So, but for those of you who are guests, you're probably asking yourself, well, what's the next step? Like, how do I make application with this? Well, you need to have an evaluation. You can't just wait till you are in pain, because how do you know if you're healthy or not? Like, how do we usually determine if we're healthy or not? Usually by how we what? By how we feel. How many of you guys know people that feel great and then they get diagnosed with cancer? Their bodies are riddled with cancer. How you feel and how your body's functioning, two different things. It may or may not be the same thing. But that would be a huge mistake to think that you're healthy because you don't have symptoms. The only way to know is to actually have an evaluation. Now, the thermal scans, remember, studies show the thermal scans can identify autonomic dysfunction. It can show problems in the nervous system. So if you look at a scan like that, and it looks like that on the left, you see all those colors, you can see how abnormal it is. And you may not have a lick of pain, but that scan tells us otherwise, compared to a normal one on the right.
Now, the other thing that we utilize if we do suspect subluxation is x-rays. And then we put the two together, and then we put all the facts together, and then we know now what you do or you don't need, or you do or you don't have. So here's a healing plan for everybody. Like, first things first. Like I said, you can detox, you can exercise, you can take supplements and good nutrition. But if your nervous system is out of balance, if you have nerve system interference, doesn't that all have limitation? How does your body coordinate all that nutrition and all the oxygenation? It's all for naught. You have to have the nervous system addressed first. Right or right? Yes. So if you're a guest here and you have not done that, do not buy any of the supplements. Do not put yourself on a body mass index scale. Don't look for that. Get your nervous system evaluated first. Now, normally that costs upwards of $400. When people come in, we have the exam, the x-rays, the scans, the report of findings. But if you're a guest here tonight, we have a friends and family coupon that we will give to you on the way out. And if you take one of these, it's good if you get it tonight only. They will make you this appointment. It's only $97. It's over $400 worth of service for only $97. It includes all of the diagnostic testing, the report of findings, the consultation, the exam. So this is an amazing value. Now, those of you who are thinking of other people that are not here tonight, ask them. They'll give you one or two or whatever you need. And these are good for 2 weeks only. In other words, the offer is good for tonight, but when they give it to you, you have to make the appointment within a 2-week period of time. And we usually have a waiting list to get in as a new patient, but Deborah has made a couple of appointment spaces open up just because we knew we were going to have guests here tonight. So if you're a guest, please don't leave without seeing the front desk up there so we can get your spine evaluated, look at your nervous system, and go over that with you. Aside of that, what else do you have to do? Second thing. Yeah, get the wrong foods out, get the right foods in. You know, the supplements that we talked about, that's an action step. For those of you who are concerned about your body weight, if you want to check in with that, get the body composition analysis. And then we talked about detox also, right? So that's important as well. And if you haven't had that done and you want to have that done, ask Deborah about that, and she'll tell you how to go about getting that testing appointment set up. So if you're already under my care, take the next step with the supplements or the body mass index, the neurotoxicity testing. Do that. But if you're a guest in here, please start with the nervous system. That is the most important part. That has preeminence and power over all the other things. If you got that right, you got the most important part and the biggest part of the foundation to get going with everything else. So hopefully you guys learned something important tonight, right? Lots of important stuff. Good. And now it's time to make applications. So see them on the way out with whatever you need, and they'll help you with your appointments, your supplements, whatever it is. So thank you so much for coming tonight. Love and appreciate you guys. God bless.